Does OCD go undiagnosed for long periods of time in both kids and adults?
That's the sad part. The statistic for a while was 11 to 17 years was the average.
Oh my gosh.
Yeah. And in about the last 10 years, that's improved. But it's still like on the 11-year end of things because it masquerades. Anybody who works with OCD has clients who have come to us after decades of being in therapy that didn't work.
Wow. When one person in a family struggles with OCD, everyone feels the ripple effects. The anxiety, the routines, the endless reassurance loops that quietly take over their daily life. My guest today, Melissa Mose, LMFT, is a therapist, educator, and author of the book, Internal Family Systems Therapy for OCD, a clinician's guide. In it, she integrates the compassionate, parts-based lens of internal family systems with the proven science of exposure and response prevention to create a more rational, relational, healing approach to OCD treatment.
So, talk therapy, you can sit and just do reassurance with your client for years.
And it goes nowhere.
Yeah, and they really like you, and you really do make,
good connection.
It feels better when they feel better when they leave. But it's a compulsion, and it's repetitive, and nothing moves.
Right. So we are subconsciously doing things to accommodate to the people within our family that may have OCD. Is that a good thing or a bad thing?
With OCD, it's a negative feedback loop, meaning, the compulsion works, right? Calms everything down in the short term. But what it does is it makes it more likely for there to be the similar obsession and need in the future. So the brain says, hey, that worked, let's do that again. And the ritual happens again, or the question happens again. And so every time we do a compulsion for our family member, we're making their OCD worse, right? So in that sense, it's not good.
Melissa's work shows that recovery isn't just about symptom reduction. It's about building new relationships, both with our loved ones and with the parts of ourselves that try to protect us from fear and uncertainty. Please join me in welcoming Melissa to the show. Hi, everyone. It's Dr. Taz. Before we get into today's episode, I just want to pause and say thank you. Your messages, your shares, your stories are the reason we make Whole Plus. Every conversation here is about connecting the science, the intuition, and everyday life together so you can feel more like yourself again. If you haven't already, hit that subscribe or follow button. It helps us reach more people who need this. All right, let's begin. Melissa, I'm so glad that you're here today. I have spent a lot of time in practice. We have a pretty big team at Whole Plus as well. We see all kinds of patients with all kinds of different diagnoses. But I think the key is that we do see the whole family. And one of the things that I am personally very passionate about, and I would say my team is as well, is that we have understood that healing happens within families and family systems. And we could do these beautiful treatment plans for the mom or a child or even the dad. But if it's not integrated within the family, the results and the success are only so much. So I know you spent a lot of time looking at internal family systems. So I would love to hear how you have stumbled upon that, how you feel about that, and kind of how that fits into really what's your area of expertise, which is OCD or obsessive compulsive disorder. And we definitely want to spend some time talking about that as well, because we see that. I almost feel like that's on the rise, but we can get into that in just a second. But talk about the family dynamic. What does it mean to have an internal family system of healing and your work in that space?
Okay, great. Well, thank you so much for having me because it's a near and dear to my heart topic as well. My 30 years of being a therapist has taken wildly different courses at various different times. I started out sort of more psychodynamic, but my training was all in family systems. So my very first internship, my very first 15 years really of being a clinician was working with teens and families. So we'd commonly have that feeling of doing great deep work in session. Kid goes home, the normal dynamics happen at home, and things just fall apart.
Right.
So Richard Schwartz, who was the developer of internal family systems, was a regular family systems therapist. Okay. And so his training was all in systems dynamics. And so he when he began to listen to his clients in a different way and understand about multiplicity, which is normal, and he really created a beautiful system for kind of understanding the internal landscape, internal conflict, in very common language that people can understand. So, what he brought, and I'll get to that in a minute, but what he brought to it was his family systems experience, where
Mm-hmm.
if somebody's dominating the conversation in the room
Right.
and the child isn't getting to speak, you might ask that person to go wait in the waiting room. So when he began working with parts on the inside of a person, he tried it and he said, do you think that really loud critical part of you could maybe just go wait on the side for a minute? And to his surprise, it worked. So the two pieces that are really important is that we see the inner landscape as a multiplicity. And it's really intuitive because we all know the experience of part of me wants to go work out and part of me wants to sit on the couch, right?
Right.
Or I'm so mean to myself. People say that all the time.
Yeah.
So who's the I and who's the myself, right? Already we're at a multiplicity. It works really well with OCD, where people are constantly saying, my brain's telling me to do this, but I know I don't have to. Or, we call it the bully in your brain. So, um, after I switched my career and began working in OCD entirely, so the last 15 years, I've specialized in that. Um, the training was fabulous. I learned amazing treatment modalities. And the OCD community is very well aware of the role of family accommodation, which I'm sure we'll get to. But
Right.
um, IFS is not a part of that landscape, right? They know what works, and they have gold standard treatments, and that's what you do. But because I've spent so much time as a clinician before specializing, you go in the room, you bring your whole self and all your tools. And I found myself using not just my family systems experience, but the internal family systems training that I had.
So for somebody like me who's not familiar
Hmm.
with any of this, so is internal family systems, is it more about you, the individual, and everything inside your landscape,
Hmm.
meaning your thoughts, your feelings, your different emotions, and learning to separate that out? Or does it also apply to the external family, like who you're living with and things like that?
Yeah, there's an awareness of internal and external, right? The external constraints are important, but primarily what internal family systems is focused on is the parts of you and how they interact, how they blend, meaning take you over, how they step back constantly throughout a day.
Mm-hmm.
Uh, and that's how we interact with the world. It's not that parts aren't bad, and you don't want to get rid of even bad parts.
Right.
Dick Schwartz is known for saying there are no bad parts. It has a good intention. It's going about it in a way that's rather extreme. So it's about shifting your awareness inside and becoming aware of various different parts of you that are like states of mind that are familiar, right? Like a people pleasing pattern.
Mm-hmm.
Thoughts and feelings show up as parts too. Not always, images or urges, anything you can experience on the inside that kind of drives what you do,
Mm-hmm.
um, is sort of one form of consciousness that we call parts. There's also a self, and self is really what's there when parts aren't taking over, right? It's just your awareness. It's the you who can be aware that you have parts. And that's an important state of mind or place to be able to access because that's where healing happens. That's where we can be open and curious and not judge and push away and struggle with our parts.
Gotcha.
So there are parts that have categories. They typically function in certain ways that are, useful, not useful. They get into struggles, they polarize, they have alliances, team up together. Certain parts pinch hit for one another. you know,
A
it's
lot going on in
yeah,
the
it's
human body.
exactly.
So,
It's like a whole they
yeah.
do operate really just like a family system inside. So,
So you were talking about your internal landscape and how you have different things probably at different times that act as the parent or the child
mhm,
or the friend or the
mhm,
bully or
yeah,
the motivator or the cheerleader, but they're all within us
yeah.
essentially at the end of the day. When we think about OCD, okay,
Mhm,
obsessive compulsive disorder, which we know affects children and we know affects adolescents and
mhm.
definitely affects adults too, what do we not understand about it when we see maybe something on TV or in a movie or things like that? Like what is OCD? How do you truly define it? And what's maybe the biggest misconception around it?
Right. So the biggest misconception I think is that it stops at wash and check, the familiar kinds of OCD. OCD is actually very complex and it can attach to pretty much anything. And it can be very subtle. So hoping to raise some awareness about that so people recognize it sooner.
Right.
But what it really is it's a combination of obsessions and compulsions. No big surprise there.
Right.
They operate in a loop where obsessions stir up things, right? They sound the alarm, they alert the system. Their function is to make sure nothing bad happens, but their method is sound the alarm, scan for data, compare things, make sure you're on guard. So there's the one side that's a really alerting energy, and then compulsions come in and fix it. And so compulsions can be the normal rituals that we see. It
This
can
is
be
where the hand washing
hand watching,
stereotype, the
yeah,
door checking, that's the
right, flipping
stereotype, right?
switches, going
Flipping
in and out of
switches, right.
rooms,
Yeah.
anything physical, we're a little more familiar with because we can see it. But there are also mental rituals where people will review conversations over in their head, or if they say something that's feels bad or off, they'll unsay it, or they'll repeat things over and over. They'll try to have a good thought and get rid of a bad thought. There's all mental rituals are happening all the time for people, and
Mm.
it's that can be a real struggle. Um, Reassurance seeking is the one that really involves the family because it involves the family members in doing compulsions with and for the person with OCD. So it might be asking a question over and over and over again for hours on the extreme end.
Mhm.
Sometimes it's more subtle, like it's a statement or a confession. Oh, I was really mad at so and so today. I had this thought. I wish, whatever. And to see if mom reacts in the car, right? And if mom doesn't get all upset, then I feel better.
Mm.
So there's subtle ways to get reassurance. And
So when somebody in your family is making these statements or has these habits that they're doing over and over again,
mhm,
correction is not the first thing to do, right? It's
right.
more reassurance is the first thing to do, is what I'm hearing you say.
Well, naturally, we reassure,
Mhm.
right? Naturally, um, whether it's avoidance, which is another kind of compulsion, actually, just stay out of it,
Mhm.
out of anything that's going to stir stuff up. But as family members, we know if we're at all attuned. We know when somebody's agitated or upset.
Right.
And as parents, of course, we want to help our children.
Right.
We want to make sure they, feel good and can function. And so we tend to be reassuring, and that's not a bad thing. I want to being a reassuring presence is not a bad thing. Answering a question for the sake of giving information is not a bad thing. But when somebody already has the information and they're asking you just to reassure them,
Mm.
this is okay, right? Yes. Okay. These kinds of questions or questions that don't have any answers, like, safety questions or is there going to be an earthquake?
Right.
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 And as parents, it's bedtime. Of course, you're going to say, like, no, there's not going to be an earthquake. Well,
Right.
we don't really know that. So it's questions that are repetitive and they're not about getting the information.
How does a parent or a partner become a part of this sort of OCD cycle in maybe a non-productive way without
Right.
realizing it? Like
Right.
what's happening there?
Well, it's so natural. And I want to say that, even as a mental health professional,
Mhm.
right? I did everything quote unquote wrong at first when I really didn't know what was going on with my daughter because sometimes there's more than one kid or everybody has to get out the door
Right.
and so you want to smooth things over and so sometimes a question will come up or it's just easier if I open the door for her, right? Or it's just easier if I answer the question or I know how agitated she gets, right? So it might be simple things like I learn through experience that everything's smoother if I don't bring up this topic. I learn through experience it's better if I leave the house late last, so nobody feels like responsible for leaving the stove on, or and
Right.
nobody wants to go back in and check. We just naturally learn how to make things go smoothly, and when that happens, and you start to notice you're doing it over and over, you start to notice there are things that you're doing for your child that you wouldn't do for your other child, for
Right.
instance, or your partner, um, that you wouldn't wanna do, right? And you might be but you're just doing it to prevent or to reduce anxiety. That's an accommodation.
Gotcha.
Well, it's a complicated question. I mean, it's bad for OCD, right?
Right.
Because with OCD, it's a negative feedback loop,
Ah,
meaning, yeah, the compulsion works, right? Calms everything down in the short term. But what it does is it makes it more likely for there to be the similar obsession and need in the future. So the brain says, hey, that worked. Let's do that again. And the ritual happens again, or the question happens again. And so every time we do a compulsion for our family member, we're making their OCD worse, right? So in that sense, it's not good, right? There are really high correlations between high accommodation and low treatment, poor treatment gains. So it does make OCD worse. Now, I want to say to parents, doesn't mean it's your fault,
right.
right? We're
Right.
doing the best that we can. But what we do matters. There are programs that actually treat just the parents, and the kid with OCD gets better. I've done it any number of times
Mm.
because we can, just by changing our own behavior, not reinforce patterns that make a big difference. So,
So what are you noticing? Like what are three things for parents listening or even partners listening
mhm,
that three accommodations we may be doing within our home
mhm.
that we don't even realize we're doing? I don't know if there's like
Yeah,
tactical examples you can give. And I would
sure.
do both for a parent and for a partner too,
Yeah.
because I know there are partners with OCD, and that can be a dynamic as well,
Right,
but
right. Yeah, so with kids, it is oftentimes question answering over and over, um, serving this particular food on that particular dish to avoid the temper tantrum, laying clothes out in a certain way,
mm,
washing extra loads of laundry, sneaks up on you, right? You don't
right,
realize, like, why are all these, like, things in the laundry basket? Well,
right,
they've been removed and put on the floor, and then they can't be worn until it just that sense of urgency is kind of a tip off. But for kids, it might be particular foods, it might be clothing items, might be that I have to wash my hands before I touch your stuff, those kinds of things. Uh, so I'm trying to give examples of both the sort of the reassurance ones and the ones where it's outright rituals,
right,
participating, buying more soap,
mm,
keeps running out, and you don't even know
right,
it at first. It's like,
right,
why are they using so much soap?
right.
Yeah, and then you realize, okay, I'm funding their OCD,
Gotcha.
right?
Okay.
Opening cabinets for people. So with partners, I've seen it end up being, well, there are certain people we don't have over. We can't entertain, or we don't entertain at all
Making
because
accommodations
it's
for them.
yeah, because
Mm,
it's such a disruption to the world and the way everything has to be. Or, well, when I turn off the TV, I know that to put the remote in the right place, or I get up and put the pillows back. Or sometimes, spouses might work less, and so people accommodate by working more. Or one partner uh, has to be the one responsible for giving medication to the children because it's too triggering for the other one.
wow. Yeah.
Yeah.
Are are there ways, well, first of all, let me ask one question. Does OCD go undiagnosed for long periods of time in both
Yes.
kids and adults?
That's the sad part.
Yeah.
Yeah, the statistic for a while was 11 to 17 years was the average.
Oh my
Yeah.
gosh.
And in about the last 10 years, that's improved, but it's still like on the 11-year end of things because it masquerades. And
Yeah.
anybody who works with OCD has clients who have come to us after decades of being in therapy that didn't work.
Wow.
So, talk therapy, you can sit and just do reassurance with your client for
And
years.
it goes
Yeah,
nowhere.
and they
Yeah.
really like you, and you
Yeah.
really do make,
A good
yeah,
connection.
yeah, yeah, it
Right.
feels
Right.
better when they
Yeah.
feel better when they leave. But it's a compulsion and it's repetitive and nothing moves.
Right. What then, I'm thinking again about the family and about relationships. How can somebody, m- you know, like have a quick checklist of like, oh my gosh, you have OCD, or I think you have OCD, and
Mhm.
let's go try to get some help, rather than being like, okay, let's make this way so that so
Mhm.
and so doesn't get upset, or
Mhm.
let me change, my behavior or what I want to do so that this person's happy. Is there like a quick like warning signs, triggers, checklist that a parent or a partner could have in their mind to be like, ah,
Mhm.
I see what's really going on here.
Right, right. Well, noticing when things start to take longer than they used to or they should. Showers are longer, homework takes forever, getting dressed is something. So you might find yourself noticing that we're late more of the time.
Mhm.
Um, it's also rigidity.
Hmm.
Uh, and not that this can masquerade as this can be multiple different things, but it has to be this way, can't be that way. And so lots of agitation or keeping things separate, not wanting school things in the bedroom. Those kinds of things that they look a little odd or they don't seem connected with anything logical. But you'll also see repetitive things. You'll notice behaviors or going in and out of doors, little signs like that. And if it's you know, starting to get bigger, that's when to pay attention. But mainly I would say to really try and find the curiosity so that it can be very frustrating
Right.
to be waiting for somebody who is taking their socks off and putting them back on again or getting totally undressed so that they could put the clothes on the right way.
Right.
And those kinds of things they don't wanna be doing either, and I hear it sadly called manipulation, that they're just manipulating you because don't don't wanna go to school and it's really not. OCD is agonizing for the person who's
Mm.
experiencing it. So when we can, as the family member, just try and lead with some curiosity, like, "What's going on for you?" And how, like, can we just, like, explore it? Like, tell me more,
Right.
I think is really important because a lot of OCD has to do with thoughts that are taboo, they're intrusive, and they're horrifying.
Mm.
And this is the type of OCD we don't see. So you might and this is another one, it might appear that your family member is just sort of spacing out and, like, tuning out.
Yeah.
And because they may be trying to undo a thought that popped into their head that was really atrocious. Like
Right.
a lot of people will get really violent images or really inappropriate sexual images and they're terrifying because they don't know it's OCD. So real gentleness and just noticing lots of time in the head
Is a
um,
sign.
is a sign.
Interesting. What is the current standard of treatment for OCD? Whether again, kid or adult, like what's sort
Yeah.
of established as like, how do you, okay, let's say you're suspicious of it, you think you might have it, or somebody that you love has it. What's
Mhm.
standard treatment?
Yeah, and this is important
Right.
because for decades, well, until about 40 years ago, I think, OCD was considered untreatable.
Really?
Yeah, it
Wow.
was it was people were
That's just
just
your personality.
yeah, it's psychotic even. People were put in institutions and just sort of left because nobody could help. So it's really important that the thing that helped, the very first treatment that helped was exposure and response prevention therapy.
Mhm.
So exposure um, was being done in the way of like habituation, like Pavlov's dogs, and
Right.
like
Yeah.
we all sort of settle down. Our nervous system settles down for a while, but the important critical element was the response prevention or the ritual prevention. So if you expose the client or the person to the scary thing, touch the doorknob to be like
Right.
easy example, and then you don't allow them, or they choose, because it's always got to be willing, they choose not to wash.
Mm-hmm.
What will happen is, just like if you walk in a dark room, your eyes adjust, right? Or you walk in a house that smells
Mm-hmm.
funny, you get used to it. In the very same way, anxiety will go down on its own eventually. And by having that experience of anxiety going down, the brain learns something new. Like, I can tolerate this. I can be with it, and it won't last forever and ruin my day. So
Gotcha.
unless they have that experience, the reinforcement of the compulsion is just too powerful. So exposure and response prevention is really important and really works. And um, I'm a big fan. I use ERP. There are other methods out there now that are more cognitive therapy,
Mm-hmm. Like CBT, like
like
cognitive behavioral
yeah,
therapy. Okay.
and there's inference-based CBT is sort of another way of looking at it, but really nothing has the research that ERP has, and the true gold standard is ERP plus medication.
So exposure response therapy
Yeah,
plus medication.
that's right.
And what medications?
Typically, it's an SSRI. It's a Zoloft, or one of those types of medications that help, and they really do. They really work, and it's different for every person, right?
Right.
I think a lot of people don't want to go that route until it gets more extreme, but OCD, and this is another thing people don't always know, OCD can be disabling.
Mm-hmm.
People don't leave the house, people don't shower, people, don't eat food, or wipe until they bleed.
Right.
It's really excruciating, and it can really ruin a life.
So the combination, so I'm curious, what does the research say about medication alone with an SSRI
Hmm.
versus the exposure response therapy alone
Hmm.
versus both together? Is there
Yeah.
some data on
I
all of that?
there's data. I don't think I have the numbers in my head,
Yeah,
but
yeah,
yes, there's data that, and it depends on the person. If you have somebody who's responding well to SSRIs, that may be all they need. They have a pretty mild form of OCD, and it seems to get better enough that they're functioning, and that's all they want to do. Um, Vice versa, some people don't want to do medication because that just has a certain resonance for
right.
them, or and so they just do ERP, and it may be harder for them, right? Because part of what the medication combination does is make it a little easier to lean into the tough work,
Mm,
to lean into having the difficult experience.
gotcha. Yeah.
And then ideally, I think ideally you can then stop the medication. But some people are like, I want to do this without that, and they try, and it's effective. And then, for those it who combine it definitely works better
If it's combined.
if it's
And
combined.
what's the treatment course? Like, is this something they have to do for a year, for 90 days? Like, or is it
Yeah.
variable?
It is variable, but people who really work in the OCD clinics really feel like there shouldn't be anything that you can't make a big difference in a few
For
months.
a few months.
Yeah.
Gotcha.
And it does work quickly. It's a really compassionate treatment. I think it gets kind of a bad rap out there because it's portrayed in the media as licking toilet seats and really
Right.
horrible, so, fear
Right.
factor kinds of things. And it's
Right.
it's really not. With a good clinician, you're being encouraged. And are you willing to try something new? And how would it be? So, those um yeah, I think it works quickly, and it's very compassionate. And
Do you see OCD coexisting with other conditions or diagnoses or diseases? For example, in clinic, we see a lot of PANS or PANDAS, the pediatric autoimmune neuroencephalitis. We see a lot of that, often triggered by a virus or a big stressor or a bacteria or something like that, and then
Mhm.
turning into this autoimmune type scenario that then becomes or presents itself, I should say, as OCD in some of the patients. Um, we have patients with eating disorders, and I'm curious, like, of that connection,
Mhm.
and does that change treatment? What's the chemistry happening there? Is there something that we as clinicians are missing? Are there other comorbidities that we
Mhm.
don't know about or we're not thinking about? So, comment for a second on some of that. That's
Yes.
heavy.
Yeah,
I know that's a heavy that's
that's
a
a
heavy category.
let's do a
But
conference,
yeah. Yes, pretty
right?
much,
I mean,
right.
it really is.
Yeah.
Because, yes, it overlaps with all kinds of different things, and the PANS and PANDAS piece is really key, especially to bring the family.
Right.
Families need to be involved in those situations, and that was that was really what sparked my turn into OCD treatment,
Yeah.
was my daughter's experience after a strep infection.
Yep.
So sudden onset, really severe, and really terrifying
Right.
because it comes out of nowhere. So it's great that there's more awareness to neuroinflammation as something that can cause these symptoms. And eating disorders actually, for some reason, co-occurs with PANS and PANDAS kids quite a bit. The food tends to
Mm.
be the object of the obsessions and the fear. Um, so eating disorders can look like OCD. OCD can look like eating disorders. They can actually be function one another and really intricately related. And you would do different treatment if it were OCD than if it were pure eating disorder. So
Hmm.
a lot of times, the ARFID, avoidant restrictive food intake disorder. Yeah.
Mm-hmm.
That's one that happens a lot because it's not and for people who have OCD that looks kind of eating disorder-ish,
Right.
their obsessions aren't really about their body, how they look. It really is more about, I don't like things that are that texture.
Yeah.
I don't like eating in these places. It has a obsessive compulsive quality to it.
Well,
And
it's a big wellness and movement risk, right? Where people are now like, I'm not going to go anywhere that serves seed oils, or
Mhm.
I'm not going to eat anything with sugar. I'm not going to eat anything with, I mean, I've actually had patients that we've tried to like reverse. This was early in the practice, but we tried to reverse neuroinflammation in different ways. And honestly, looking back, may have made things worse because it triggered like orthorexia in them, where
Right.
they became obsessive compulsive about
Mhm.
like the ingredient in every single thing, to the point that they're food restricting and food restricting and food restricting. And next thing you know, it's turned into an eating disorder.
Right, and then that gets into the whole lifestyle piece of
Right.
wanting to have the right mindset,
Right.
right? And I can't get out of bed until I get in the right mindset,
Right.
and they're watching
Yeah. I'm going to
influencers who
protect
are
my peace.
yeah,
Yeah. So,
exactly,
like,
exactly. And
got it.
so then that's really quite a head trip. Am I in
Right.
the right mindset? Can I move forward? What is it? How's it gonna so, because you can hyper focus on pretty much anything.
Right.
Yeah, so it's a balancing act of, teasing apart what's what because it also co-occurs with trauma, um, autism,
Yes.
right? That's another one where it can they can both be there,
Right.
or one can look like the other.
So,
ADHD,
just sorry to
yeah.
interrupt. Does trauma trigger OCD?
Well, trauma doesn't cause OCD. We're pretty, solid and want to be very clear about that. It
Right.
can trigger an onset in somebody who is maybe genetically predisposed, maybe also has some other co-occurring thing like the inflammation. But OCD can get kind of wrapped up in a traumatic experience and serve as a protective mechanism
Mm.
and get reinforced. So when both are there, it's really complicated. But we do, yeah, we do sort of, it's not just trauma causing OCD.
And how is OCD related to ADHD or attention deficit syndrome?
Yeah, there's this triad, especially
Yeah.
in kids,
Yeah.
right?
Well, I
OCD,
talk about the triangle all the time for
yeah,
everything. I'm like,
yeah.
it's always
There's
three.
always a
There's always
triangle,
three. There's
right?
always a triangle.
That's right.
So your goal is to figure out your triangle. So,
Exactly,
but
exactly. Yeah, so OCD, ADHD, and Tourette syndrome,
right.
right? So with the tics in young kids, and yeah, that does complicate things also a little bit because sometimes ADHD medications can increase
Trigger.
anxiety
Yeah.
and cause those kinds of things. So um, also they get misdiagnosed. I've a number of kids that I've worked with were diagnosed with ADHD because they're staring out the window, they're inattentive,
Right.
and teachers don't realize they're inattentive because they're trying to replace the bad thought they just had with the good thought, and things have to be just right before they can take the math book out. And so, yeah, uh, the co-occurrent, they do find that people with OCD have a much higher incident of other co-occurring disorders. And so we do have to be careful about how we.
Is OCD born in in let me phrase this correctly. Is OCD born in conditions where there is chronic inflammation?
I'm beginning to believe we're gonna find out more and more that that's true. I think that that's what the pans and pandas,
Right.
like cases that were more extreme, kind of led us to discover. And also when people get sick, their OCD spikes.
Mm.
It spikes with hormones. That's why you see all the perinatal OCD. So, there's all kinds
What
of,
about like perimenopause and menopause?
yeah, I think that
That
can,
will trigger it as well?
you don't see that as much because it's a decline in hormones rather
Right.
than
A
the
spike
surge
in
that happens,
hormones.
but,
Okay.
but I, working with teenage girls, it's like, or, young women, you always say, well, it's, week before my period and my OCD is going crazy. So it's very standard to recognize that it's biochemically based
Induced.
and induced and triggered. Yeah.
So, is the solution for somebody like that, if anyone's listening to us and they notice these symptoms worsen, like maybe the week before your cycle, or they're worsening when you ovulate, like at a spike, right? When
Mm-hmm.
you have that surge, or you might be pregnant and having a surge of progesterone, or doing IVF and getting a surge of hormones.
Mm-hmm. Mm-hmm.
So, for any of those folks, if they're noticing that that's when their OCD flares and it's not constant necessarily, what is their treatment strategy to manage that?
That's a tough one because there are probably a lot of things out there in the
Yeah.
way of, supplements or anti-inflammatories, the anti-inflammatory diet.
Hmm.
There are probably things out there that would be helpful. And I'm not an expert on those things, but I also know that it really depends on the person, what kind of energy, effort, and ability they have to utilize those kinds of auxiliary treatment methods to optimize their functioning. I think a lot of, for me, the way I work because of the internal family
Right.
systems approach
Mhm.
is to notice again that parts are your parts are really active right now,
Right.
and helping people learn the skill of unblending so they can say, a part of me's freaking out right now and I just need to focus on getting my kids to school rather than I'm so anxious I can't function, rather than identifying with the feelings. So,
Are you concerned that when you look at Gen Z, for example,
mhm,
um, that there's a little bit of parking or hyper fixating on the fact that there is a mental health issue?
mhm,
In fact, I think I saw a survey recently that said 75% of Gen Z women, girls, report that they have some mental health something, right? And there's a TikTok trend going around recently of like all these young women, girls and younger women, like, yeah, well, here's my mental health cocktail and like downing like a bunch of
right,
whatever. Are you are you concerned that there's this hyperfixation just around that and not an understanding that we got to keep moving? Like,
right,
this is not a reason to stop what you're doing, to quit what you're doing. You got to keep moving through it,
right, yeah,
especially for somebody who's practiced for 15, 16 years.
right, right. So yes, and I have to say I love Gen Z.
I have a Gen Zer.
There's
I have, they're in my home. Trust me.
yeah,
Yeah.
yeah, their sense of
Yeah.
humor and their
Yeah.
view of the world, it
Yeah.
cracks me up. They're great. And yes, they're like, love me a good diagnosis. I've
Right.
heard that one, right?
Yeah.
And so that's great. Um, it can't, like anything else, right? It's like it's functional until it stops being helpful anymore. I think in a certain way, open awareness, inclusion, it's easier to talk about these things
Right.
is great.
Right.
I am well aware that when I was a teenager, I probably had some clinical anxiety around things or
Right.
social anxiety,
Right.
but I didn't think I even knew the word anxiety. I literally thought that I got excited about taking the SAT
Right.
and I was just nervous probably.
Right.
So it was good for me to not know that is my
Yeah.
point.
Yeah.
And I think with these kids, yeah, it can be a rabbit hole. It can be an excuse to opt out,
Yeah.
and that is not healthy. And then identifying with the diagnosis, and so it's unfortunate, but it
It's the
also
reality.
hopefully like other things, it gets extreme and then it comes kind of back into the fold when people start to realize the other side of it.
Would a better message be one that we could all spread that, look, this is a disorder of inflammation,
Hmm.
neuroinflammation in particular, which actually has solutions,
Hmm.
and it's not necessarily a part of your personality? Because I think that's the myth
Yeah,
out there.
yeah,
Like, oh, I just have OCD. Like, you
yeah.
know what I mean? It's almost like a
Yeah,
type.
yeah, yeah.
So instead of like perpetuating that myth that OCD is integrated into your personality, it may actually be a symptom
Mhm.
of neuroinflammation. And for
Right.
that, there is a plan, you know?
Yeah. And well, I think anything that reduces shame is
Yeah.
important and that increases hope. I hear a lot OCD is untreatable and
Right.
it's not
Hmm.
not the case. And then the other end of I'm so OCD,
Yeah. Yeah.
OCD is not an adjective. If you actually have the D
Yeah. Right.
part, it's wrecking your
Yeah.
life. So
Right.
that's not anything fun,
Right.
right? So I really agree with you to focus on we are a brain body system and we come wired in a certain way and we have capacities and we have you know things that we're not as good at and our like to see it as the body can be attended to in a way that's going to minimize that and no it's not a personality thing.
I think
Yeah.
that in itself is such an important message. Does it look different in men?
Oh, interesting. In some very major ways, no.
Okay.
It's like I mean, it appears at different times. I get a lot of 11-year-old girls,
Yeah.
and the boys tend to be a little older or adolescent. But in terms of the fears and the thoughts, the intrusive thoughts. I mean, intrusive thoughts seem to be very different or very much the same. People don't wanna be, "What if I'm a bad person?"
Mm.
Right? "What if I'm careless what if I'm a monster? What if I really want to hurt people?" I wanna really call attention that that's a really common
Hmm.
kind of OCD that we don't really talk about, and people are wandering around thinking, "What if I really intended to bump her elbow when I passed her on the street? What if I'm"
Yeah.
and it's really debilitating, but I see that in boys, see that in girls. I think the subtypes, OCD is the process underneath it all, right? It's the alert and then the fix, and the alert and then the fix. And that's how we tell it from other things. But the content of it might occur more in certain contexts than in others. In religious households,
Mhm.
the scrupulosity piece, like, did I pray enough? Am I devout enough? Whereas other places that might look more like morality and, did I cheat or did I represent myself accurately? So the flavoring of the content might change, um, but no, it's pretty
It's
equal
pretty
opportunity.
consistent
Yeah.
across the board.
Mhm.
Are there medications that worsen OCD?
It can depend, again, medications are so
Tricky.
people
Yeah.
specific, but, Ritalin can definitely, that like we said, the ADHD medicines can worsen it. I'm sure that there are some that I'm not aware of, but
Mhm.
I think anything, whenever you notice I'm in a spike or you notice your family members in a spike, they may not even realize it, but you've just seen them walk in and out of
Right,
their room
right.
five times or whatever.
Right.
You're not necessarily without being judgmental, right? You want to maybe call attention to it, but track what happened. Like,
Mhm.
what are the antecedents to this? And so then maybe if it is a medication or if it is some sort of a substance or it's a interaction, it's certain people that they
Right.
hang out with or stress. Stress can
Right.
definitely make it worse.
Now, sometimes OCD is also worn as a badge of honor,
Yeah.
right? I'm
Mhm.
type A, I'm OCD,
Mhm.
I'm blah, 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 right? Or because they're OCD, they were successful and able to do X, Y, and Z. Or we
Yeah.
hear about, I think, Steve Jobs or like some of these, figures in our culture and
Mhm.
history that like you hear about like how they worked or, some of their habits and their rituals. And people attribute that to being part of why they're successful. Like, what's
Mhm.
your thought there?
Well, again, any of these behaviors function on a spectrum, right?
Right.
Anxiety too, we have that optimal anxiety, right? So
Right.
a little anxiety before a test is a good
It's a
thing.
good thing. Yeah.
If it gets too intense, then it starts, taking me away from what I'm meant to do. So, if you have a touch of perfectionism, that's not a bad thing. But if your perfectionism is keeping you from sending an email until you reread it about 70 times,
Yeah.
so
It's on a spectrum.
yeah, it's on a spectrum. And I do think that people who really have the disorder, who are locked in their homes or can't leave until, I mean, they're just in agony. I
Yeah.
think that kind of, I'm so OCD. or OCD works for me kind of attitude. It feels dismissive and
of the
yeah,
actual
of the
condition.
actual gravity of it, you know.
Interesting.
Yeah.
So going back to internal family systems,
Mhm.
right? So someone you love has OCD, child or a partner. Can we be participants in an internal family system for somebody, or is that something that really needs to be done with like a professional who's trained in that work and knows how to do that work?
Well, I think the most fundamental thing we can do as parents is our own work,
Mhm.
right? So if I show up when my daughter is struggling, I show up with a really anxious part in the lead or a controlling one that wants to tell her what to do or one that's exasperated because, like if I show up with a part in the lead, uh, it's going to negatively impact her
Mm.
because my parts are going to draw her parts, right? My overly going to fix it part might draw
Mhm.
her anger and or whatever. It just in general, we want to be as self-led as we can be. So I want to notice, okay, I have a part that's like wanting to just tell her what to do,
Right.
right?
We all do.
I've got yeah.
Yeah.
And then I have another part that just wants to do it for her.
We have that
That's
part too. So,
hurting,
yeah.
right?
Uh-huh.
And I can really speak for those parts in my own mind, like naming them really helps.
Yeah.
Just like anytime you are in a struggle to really name what the other person is feeling helps them relax. So naming that or I'm angry, like sometimes the level of anger we have, we don't want to be that parent,
Right.
right?
Yeah.
So that's one for me. I just like, I'm not angry, but sometimes I'm angry. So if I can just notice, and now that she's older, I can say, part of me is really angry right now. I know you're doing the best you can. So just that kind of communication and that kind of self awareness allows us to be self led in a situation where we can have compassion for what they're going through.
Mhm.
We don't have to say, there's nothing wrong, go ahead and touch it.
Yeah.
Or
Or you're being crazy
you're being
or
crazy. So we don't have to be sort of overly demanding of functioning. And we don't have to be overly reassuring and, oh, it's okay, I'll help you, because that sends the wrong message too, right? You can't handle it. Anxiety's bad. We don't have anxiety in this house. We fix it,
mm,
right? So both of those send the wrong message. But if I can be in a little bit of clarity enough to have the compassion, but also the confidence, like, I know it's really uncomfortable right now. I know you're struggling and you're really anxious, but I have confidence in you. I know you will get through this.
mm.
Not, I know everything's going to be okay because that's a reassurance, but I'm here with you. You'll,
Okay, so help us with that
yeah.
because okay, I'll put my fix it, angry, controlling pieces
Mhm,
off to the side
mhm,
and I want to be present.
right,
Give us like 3 phrases that we could use if it's a child or if it's an adult.
right. Yeah, I know this is really hard for you.
Yeah.
And I know you'll get through it. I mean, just like I just said, I'm here with you. I'll hang out. And, I really trust that you can be with this and do the thing that your therapist has been telling you to do. Or, I'll help you resist that compulsion. Like by just being a presence, right? Because what we know is we want to partner with the part of our child or our partner. We're going to partner with the aspect of them that wants to get better because they know they don't really want to do the compulsion,
Mm.
right? And so trying to really find the self in somebody. Like, I get that you want to go take your clothes off again. I also know you know what that means, right? So I'm here. I know you can, I believe in you. I think I believe in you is really important. And I know you're struggling. So that's compassion and it's confidence.
Mm.
And I'm here.
So are those the 2 words we should remember? Compassion and confidence in our
Yeah,
statements?
I really think so. Yeah.
Yeah.
It's because our confidence that one, anxiety isn't going to kill you. So it's an uncomfortable
That's really
feeling,
so I think that's really important. I think
right?
for everyone needs to hear that.
Yeah.
Anxiety is not gonna kill
Yeah.
anyone.
We don't need to like,
Yeah.
yeah,
Uh,
if the other option is doing things that are ruining your life, taking you away, making you quit soccer, stay in the room, not take that job, it, feel anxious. It's just a feeling, right? If we
mm,
can have that kind of message, It's a really uncomfortable feeling, you know? I think we can share anything that, we can relate. Um, I've developed this fear of heights, right? So I get near a banister or
Yeah.
something, all of a
Yeah.
sudden my nervous system flares, but I think of it as, wow, my body's doing that thing again. I don't feel like I'm scared, but I know how uncomfortable it is.
Mm. So you're
S-
almost like not reassuring. You're almost calming yourself down a little bit.
Yeah,
Yeah.
yeah,
Yeah.
yeah. I'm just disidentifying from the feeling. I don't have to see the thing my body is doing as me
Gotcha.
because there's so many other parts of me.
Mm.
There's the part of me that wants to like go stand at the edge or go skydiving. I don't know. But so there's you can always find another part of you that sees it differently. And when you do that, you know, um, you're more aware of the you who's aware. That's the self. That's where we want
Fascinating.
to be.
How does OCD affect intimacy between partners
Yeah,
and
it can be.
even
Yeah.
like connection? How does it impact that?
A lot it can really get in the way, especially there's a type of OCD called relationship OCD,
Mm-hmm.
and the obsessions, begin to, swirl around the partner or your own feelings about the partner. So, do I have is this the one? Is this person the right person for me? Or does he love me in the right way? Or, all
So
of
the
the
person with OCD is constantly processing
yeah.
that.
Yeah, so it's kind of along the lines of an intolerance of uncertainty. We haven't talked about that yet.
No, we haven't. We need to talk about that. So
Yeah, yeah,
yeah.
yeah. Because that's at the root of almost all OCD is
Okay.
I need to know for sure. Like OCD is like it guilty until proven innocent. I need to know for sure that he loves me. I need to know for sure that I'm a good person and I'm not going to hell. I need to know for sure that that thing is clean and hasn't touched anything. And even if I can't see anything on it, does it have the essence of that dirty substance on it? Right? It's like OCD wants absolutes. And
Answers. Yeah.
yeah, answers for questions that have no answers, right? No concrete answers. And so living in uncertainty is really one of the main solutions to the problem, right? It's the treatment method of choice, it's the exposure lifestyle. It's like, what if we don't get to know? So to bring it back to your question about relationships, it's it's a risk, right? It's kind of the ultimate risk. You sort of invest in this other person and you don't get to know what they're thinking all the time. So
And how do we get comfortable in that for people with OCD? How do they get comfortable in living in uncertainty? Or how do any of us get comfortable? And I mean, I know some people have faith and some people
mhm,
have other tools, but how does one get comfortable with that idea that we just don't know?
yeah.
And that's okay.
The first word that came to mind, and I haven't thought of this in a long time, was awe.
Ah,
If
I
we
haven't
can
heard that word in
yeah,
forever.
just
Yeah.
like it's a kind of amazing how much we don't know if we really think about it, and that can be very triggering for people.
Hmm.
But making space for that, giving it a different spin, like beginner's mind, right? Traveling's fun because it's like everything's new,
Yeah.
right?
Yeah.
So that uncertainty, like kind of learning how to embrace it and lean into it and realize when you lean into one uncertain situation, for instance, the more you're with it, the more familiar it becomes. And so just knowing it's not what you know or don't know, it's what you do when you don't know. When it's what you do when you're uncertain. And can you just breathe into it and make space for it and let it sort of be there and focus on what you do know.
Hmm.
And the trick is kind of turning the flashlight of your attention out into the world and to look around and say, I'm safe right now. And I'm doing this thing that's really fun and I'll just focus here and be in the present moment. So I think that that's really the mindfulness tools that we see everywhere can be really useful. Getting into your body, finding all of your toes.
Almost like grounding
Grounding.
and kind of bringing you back into your physical.
Right.
Do you have favorites? Favorite tools that kids can use to get there? Favorite tools that adults can use to get there?
Well, kids do really well with IFS.
Yeah.
Like they do really well
Internal family
with
systems. Yeah.
internal family
Yeah.
systems,
Okay.
like seeing the obsessional part and the compulsive part as different parts of them.
Yeah.
You know, this is my what if monster. This is negative Nancy.
Mhm. Yeah. Yeah.
This is and so I think externalizing is really helpful.
Okay.
So if you're a child and you want to, like, this toy represents that thought and this toy represents that thought, and I can look at them and go, I know they're just that. They're just
Yeah.
thoughts,
Yeah.
so it helps, it helps to put things outside of your body, draw it.
Right.
I think adults kind of, well, I love, I mean, of course, having a kid, I still have lots of little toys around the house and my
Mhm.
office has lots of things, but I think it's great to just go, the part of me, as I was writing this book, the part of me that's taking this perspective is here, and the part that's taking this perspective is there because I'm balancing two very different worlds, right? And it's a reminder in the external world. Adults, I think, like to maybe put things out in writing.
So
Um,
writing about it.
Yeah, not getting entangled in content. This is where I'm a little bit cautious. It's like, worry, that's a worry
Yeah.
right now. I'm gonna set it aside and keep functioning. So it's that kind of unblending tools I think are great. Um, but also just welcoming
Mhm.
whatever is coming up that's uncomfortable
And uncertain.
and uncertain, right? So I like to say, you know, welcome whatever's arising. Just don't follow it.
Right.
Right?
Right.
Let it go through and out. Take a deep breath and then keep
Don't
moving.
park and attach to it
Yeah,
necessarily.
exactly, exactly.
So tell us about the book. We haven't talked even about the book, and I know you're training. You told me in the beginning of our conversation you were training a lot of clinicians. I'm
Mhm.
curious, like from your vantage point, what do we clinicians miss
Mm.
frequently in practice? What's your hope for the book?
Yeah. Well, my hope for the book is that, it just enlivens, enriches, and deepens what we're already doing when we're treating OCD, and the gold standard treatments are great. IFS is just a deeper way of getting there, and it's a really helpful tool for when people aren't ready to or willing to do exposures
Mm,
because we can work with the parts of them that get in the way. So, I've it was a dicey thing because the people in my OCD community, and
right.
I'm very deeply in that community of clinicians, were really protective of new methods
Uh,
that don't have evidence,
yeah.
right? It's
Yeah.
like, don't
Same.
try that, right?
Yeah. Yeah.
But IFS is just such a natural, it's like if you infuse your practice with an awareness of who am I talking to right now,
Mm-hmm.
right? I'm talking to the compliant part of my client who's just doing whatever I say to get to do treatment right.
Right.
Or am I talking to a part that, I don't know, is just engaging in white knuckling through this thing. Just
Mm-hmm.
being aware of what part of your client you're talking to, resistant part. Sometimes the part that's like, no, that one's too scary. I can't do that. It's
Yeah.
just like parts with agendas. Um, I think that's incredibly helpful. I've had clients say, well, when you have access to yourself while you're doing an exposure, it makes all the difference,
Hmm.
right? The other thing that IFS is really good for when you're really aware of that internal family systems dynamic is self compassion. And we have discovered that there's a lot of shame and blame and guilt in everywhere, but in OCD in particular. People get really hard on themselves when they don't do their exposure homework, or if they go ahead and do a compulsion because they just couldn't stand
Yeah.
not doing it, right?
Yeah.
So self-compassion is a very healing state, but it's really hard to tell somebody to have some compassion for yourself.
Right.
I don't
Right.
deserve it, or there's all these things that come up.
Right.
Internal family systems is a really natural way to notice the part and ask it to step back. How do you feel towards that obsessional part? I hate it. Oh, so let's focus on the part that hates it for a minute. How does that show up in your body? Oh, it's just like a clenched feeling or whatever. So let's just focus on that one and listen to its message. Let it know that you hear it, right? It's got a point. This has been really hard on you. I kind of don't blame that part of you for hating OCD.
Mm-hmm.
Yeah. But if we're going to help OCD, we might need to spend some time looking at it. So, would that hatred for it be willing to soften for a second? Could it sort of sit to the side of you? Um, and people really have great experiences with that when they turn their attention inside and they start to notice all the different parts of them that are going and they unblend from those. What happens naturally is compassion and self
Mm.
compassion. So after you unblend from the part that hates it, now what do you feel towards that scared, anxious part of you that's running the show? Well, now I kind of feel for her, you know.
It's the
Or
empathy. Yeah.
yeah, now, yeah. Or I'm kind of curious what that's all about. Or some, the 8 C's:
Yeah.
curiosity,
Yeah.
compassion, clarity, courage, confidence. One of those will show up, and people tend to have proclivities and towards one or another, but some aspect of it, even just neutral, like, I don't know, maybe I'm a little open. Open's a good word. And that's what we're looking for, is just finding that open space so that we can be with whatever's going on in a deep and present way and have a new experience, because that's really the key. It's like when I hear, wow, that wasn't as hard as I thought it was going to
Right.
be. I
Right.
know,
That's a win.
that's a win. That's great. We've had a new experience. And, let's face it, it's all about learning.
Mm-hmm.
Do it again. And, what you practice, you get better at. If you can practice noticing the parts that are with all the chatter and allowing your attention to shift them into the background rather than the foreground, um, every time you do it, you get a little better at it. You're a little more present. There's a little more space inside of you to be strong through the next challenge.
Those are lessons that we can all use,
I
not
know.
just in
I
OCD,
know.
right?
That
So,
was my thought
yeah.
when my daughter was little. It was like,
Yeah.
well, silver lining is she's learning stuff now that a lot of adults never
We
get to.
never learn or
Yeah.
never get to. But I love that, the lessons of self-compassion, blending. You talked
Mm-hmm.
about multi-blending,
Mm-hmm.
separating out these
Right.
different pieces of ourselves. Hopefully, this will be helpful for any family dealing with somebody that has OCD, or if somebody individually is dealing with OCD and maybe it hasn't gone diagnosed, like you said, for almost, 11 to 17 years. That's a long time.
Right.
So I hope this message gets out there. And if
Mm-hmm.
someone wanted to reach out to you and get more
Mm-hmm.
information, how can folks connect with you?
My website is melissamosmft.com.
Okay.
And I also have an IFS for OCD.com website where I'm beginning to create a little more community around if you're curious about that. But yeah, reach out to me, send me an email.
And the book is
Um,
targeting clinicians
the book
primarily,
is
right?
targeting clinicians.
Okay.
And yeah, my hope really is there are a lot of therapists out there who get very little training on OCD, but they really love internal family systems or are curious. And so this book is really meant to spread the word of, if you're seeing these are things you should really know.
And be thinking
And
about.
and
Yeah.
even if you're doing really beautiful, wonderful, deep IFS treatment, you also need to know that at some point in time, somebody needs to face the fears, and they can face it in this really beautiful, compassionate, deep, healing way with the addition of IFS.
I love that. I think this is such important information. And I'm even thinking about our exam room experience, right? And
Right.
now being able to identify it a little bit better and really get folks help, and then marrying the work you're doing with a lot of the work that we do day in and day out around neuroinflammation and understanding the triggers and where it's coming from. I mean, I think that is a healing journey that I hope anybody with OCD will go on, regardless of how old they are. And for the rest of us supporting those folks, like, we're a little bit more educated as well. I'm gonna ask you one last question.
Okay.
What makes you whole?
Oh, wow. What makes me whole is peace, is quiet, that just a still moment.
So hard to get those.
Just it, and it, but remembering it doesn't take that long to
Yeah.
just open, because you know what? Yeah, we're whole. Nothing has to make me whole. I just have to notice it.
Go find it.
Just
Yeah.
have to let it all be there, and Nature sure
That
helps,
might be
but
one of my favorite answers. People usually say family or, something, but we're already whole.
yeah,
We
yeah.
just lose it
We just
sometimes.
forget,
We
and we
just
have
forget,
yeah.
so.
So,
Well,
yeah.
thank you so much for your time today. I really appreciate it. I hope this is a good message for everybody. Spread the word if you know somebody suffering with OCD or a family that is, knocking around trying to find its way, or you have a partner or it's you and you just need some extra help. Thank you all for joining me. Don't forget that we post new episodes every week. I'll see you next time. Before you go, remember healing doesn't happen all at once. It happens in moments. If today's episode gave you one of those moments, subscribe and keep learning with me. The next video is right here and it picks up right where this one left off.